Good morning, everyone. Today I will be sharing the psychological assessment we conduct on our client, Lynn. This is our cosmic details. Psychological testing is a scientific method used to measure specific psychological traits and difference between individuals. It can help us understanding both subjective experience like feeling and attitude and objective behavior we observe. In this case, our focus was on assessing depressive symptoms on and self-esteem. For this assignment, we aim to evaluate the severity of Lynn's depressions, explore the psychological issue affecting her daily functioning, and provide evidence-based interpretation that could guide possible intervention. Our client, Lynn, from our interview, Lynn shared that she has lost interest in social activity, often feel fatigued and struggle to concentrate in class. She has frequent negative self-doubt such as I'm not good enough, I'm a loser, feel like she's lost on a different planet. Like many college students, she faced academic pressure, future planning stress, and challenge in building relationships, all of which can contribute to mental distress. Research by Justin Hung in 2010 highlighted that college students are a high-risk group for depressions, making early identification and intervention is important. Although Lynn continued to fulfill her academic responsibility, she experienced emotion numbs, social withdrawal, and low motivation on a daily basis. This observation, together with her high BDI-2 score, confirmed the presence of severe depression symptoms. Our objective and method for Lynn, we use the BATS Depression Inventory tool to measure her depression symptom. Her BDI-2 score was 36. According to the scale, this indicated severe depression. In our evaluation, we consider both humanity theory and cognitive behavior therapies perspective to guide our interpretation and recommendations.
Thanks for the clear introduction. I'll take it from here. Let me share about the test selection. The test selected for this case is the Back Depression Inventory II, or BDI2. It is a 21-item self-report questionnaire and designed to measure the intensity and severity of depressive symptoms for individuals aged 13 and above. The BDI2 is one of the most widely used instruments in both clinical and research settings because it follows the diagnostic criteria for depressions. And compared to the other tools like the SF36, the BDI2 is more specific and focused on depression, which makes it especially useful in identifying the level of severity and understanding the symptom in detail. Next, we chose the BDI2 for this case because it directly relates to Lynn's problems and symptoms. Lynn is a 20-year-old student who reportedly constant sadness, low energy, withdrawal from others, and difficulty concentration. The BDI2 is helpful here because it measures both emotional symptoms like guilt and hopelessness and physical symptoms like changes in sleep and appetite. It also has strong reliability and validity, which means that the results can be trusted. By using this tool, we can capture a comprehensive pictures of Lane's depressions and covering both psychologic and physiologic aspects that use it to guide treatment effectively.
My role in our project was to simulate administration of the Back Depression Inventory 2 or BDI2 to our hypothetical client Lynn. The BDI2 is widely used psychological tool for assessing depression severity in adolescents and adults. The purpose of administering The BDI-2 in this simulation was to measure severity of Lynn's depressive symptoms, identify specific areas affecting her daily life, and guide recommendations for intervention. It also ensured we followed ethical and standardized testing procedures. We conducted the simulation in a quiet, private counseling room to ensure confidentiality. Materials prepared included the printed BDI questionnaire, a consent form, a scoring sheet, and the Columbia Suicide Severity Rating Scale for follow up in case suicidal ideation was detected. The environment was kept distraction free and comfortable so Lynn could focus on the task. The process began by building rapport with Lynn to make her feel comfortable. I explained the test purpose and how to answer the questions. She was instructed to select the statement in each of the 21 items that best described how she had been feeling in the past 2 weeks, including today. I observed quietly without influencing her answers. After she finished, I checked the form for completeness, reviewed the suicidal ideation item 9, and since it was endorsed, and proceeded to the CSSR screening for safety. As for administration outcome, the administration took about 10 minutes. Lynn completed all items without difficulty. Item 9 indicated some suicidal thoughts, though without plan or intent, which required further safety assessment. The process was smooth and followed all necessary protocols, ensuring both accurate data collection and client safety.
Here are the test results. For our client Lynn, we administered the back depression inventory tool, which measures the severity of depressive symptoms. A total score was 36 out of 63, placing her in the severe depression category. The highest scoring areas were loss of interest in activities, fatigue and low energy, difficulty concentrating, and negative self evaluation and occasional suicidal ideation without a plan or intent. As shown in the chart, her most significant symptoms are negative self perception and chronic fatigue, which are strongly impacting her daily functioning. These results suggest that Lynn's depression is affecting her on multiple levels. Cognitively, she experienced persistent negative thoughts and hopelessness. Emotionally, she reports emotional numbness, sadness, and loss of pleasure in activity she once enjoyed. Behaviorally, she is withdrawing from peers, losing motivation, and disengaging from social and academic activities. Low self esteem and depressive symptoms seem to reinforce each other, creating a cycle that makes recovery more difficult. The presence of suicidal thoughts means ongoing monitoring and support are essential. From a psychological theory perspective, we can explain Lynn's symptoms using three main frameworks. First, back cognitive theory, which identify the negative cognitive triad, negative views of the self, the world, and the future. Lynn's thoughts such as I'm a loser show all three elements. Second, self-esteem theory, which tell us that low self-worth increases vulnerability to depression, and we see that clearly in a case. Finally, the cognitive behavioral framework, which explains how her avoidance and withdrawal reduce positive enforcement, further deepening depression. These theories guide us toward intervention like disrupting the behavior activation and self-esteem building.
Lynn's score of 36 on the BDI tool shows she has severe depression. Our first priority is safety. She needs a full suicide risk check using the Columbia Suicide Severity Rating Scale. For treatment, we recommend two types of therapy. The first one is cognitive behavioral therapy. It can help her challenge negative thoughts. And the next one is person centered therapy, which can rebuild her self worth and self acceptance. She also needs academic support. such as lighter work loss and better study strategies to reduce stress. Behavioral activation is important too. This means slowly reintroducing her to hobbies and social activities. Lifestyle changes, like more exercise and better sleep, will support her recovery. Finally, she should retake the BDI tool every 4 to 6 weeks. This way, her progress can be tracked and treatment can be adjusted if needed. As conclusion, the BDI tool gave us a clear and objective picture of Lynn's mental health. Her score confirms severe depressions with symptoms like sadness, fatigue, poor focus, social withdrawal, and low self-esteem. Because she sometimes has suicidal thoughts, urgent care is needed. Psychological testing is very useful. It turns personal feelings into measurable data. This helps us diagnose accurately, plan treatment, and monitor progress. In Lynn's case, we apply theories such as the cognitive model of depression and the self-esteem theory. These frameworks help us choose the right therapies for her. In conclusion, tools like the BDI tool are essential. They allow us to detect problems early, provide targeted support, and improve long-term mental health outcomes.